Hello, this is Glenn Kelly, the president of Second Chance for Life. The following is an edited recording from a webinar presentation on September 15th, 2021. Michael Petty, who is a clinical nursing specialist and an adjunct clinical assistant professor at the University of Minnesota's School of Nursing, spent an hour with us discussing caregivers within the heart failure community, including transplant and VAD patients. With understanding the importance of friends or family that act as a patient's caregiver, Michael identifies some common challenges and self-care strategies for caregivers. The final Q&A portion was not recorded due to respect of privacy for those participants during the Q&A. So this session lasts about 30 minutes. We pick up in the presentation where Michael is introducing the objectives for the session.
Literature on the experience of those caregivers and explore the concept of stress related to caring, and then think about a couple of potential strategies caregivers can use to reduce stress. Part of the goal of this session is also to find out from you the things that you're struggling with or that you want to talk about. So the presentation session I'm planning on for about a half an hour to 40 minutes, and then we'll go from there to question and answer or discussion. So Rosalind Carter a long time ago said there are four kinds of people in the world. The first are those who have been caregivers. Second, those who are currently caregivers. Third, those who are going to be caregivers. They may or may not know that yet. And fourth, those of us that will need caregivers. So honestly, caregiving is so entrenched throughout the community that it's really pretty impressive. The amount of work that's done by family caregivers, and it's not always family. Sometimes it's friends or church members or whatever. There are over 58 million deaths in 2005 around the globe. About 60% of those were from chronic illnesses, and chronic illness affects about 177 million Americans, which is about 60% of the population. 40% have two or more chronic conditions. So when you think about that number of people and that amount of chronic illness, you can appreciate that there's likely going to be caregivers and caregiving integral in the life of many families in supporting people with these illnesses. In a national survey, though, when we took a look at those caregivers, this national survey was published in 2017. AARP is very focused or has one of their many foci being on caregivers. And they, in this particular survey, looked at almost 1,100 people who were self-identifying as caregivers. 40% of them reported that they were not prepared to assume the role of caregiver when they did it. And of the 60% who did feel prepared, only 16% felt they were well prepared. So those who expressed being prepared had more positive emotions to describe their caregiving experience, and older caregivers reported being more prepared to do so than younger caregivers. For whatever reason, either because they were older and they'd done it before or done it multiple times or whatever. While positive emotions of caregivers outweighed negative emotions, more than half of caregivers that were studied in this group of 1,100 were stressed or worried, and many expressed feelings of being overwhelmed. More than half described, in contrast to all of those negative statements, more than half described unexpected joy from being a caregiver. So of those surveyed, 54% faced challenges when caring for their household. 41% were challenged to care for their own health at the same time that they were being a caregiver for others. So does a caregiver actually realize they are one when they get to be one? So kind of going off of Jeff Foxworthy, and you are a caregiver if you, there were four statements that I found that I thought made sense. The first, you're a caregiver if you take care of somebody who has a chronic illness or disease, if you manage medications or talk to doctors and nurses on someone's behalf, if you help bathe or dress somebody who's frail or disabled, or if you take care of household chores like meals or bills for somebody who can't not do those things by themselves. So those are some characteristics that often help us to understand that I guess I do qualify as a caregiver. This study by Wingham, also published in 2017, really tried to characterize the experience of the caregiver. And this kind of bullet graph is interesting because it tells you by how far out the points reach what particular areas were of concern to those individuals. And you can see probably the most important ones are the five that I've starred. They're the ones that reach the furthest out, meaning they have the most impact. And they include being excluded by healthcare professionals, having a role conflict. Am I a wife? Am I a caregiver? A sense of hopelessness, fear for the future, and the most important one is feeling alone. Now, everybody recognizes the need because we all recognize how many caregivers there are around. And even things like the AARP Journal or the newsletter for healthy living that's published by AARP all talk about strategies for caregiver self-care and ways that people can help caregivers who are in the midst of providing care. Of the more than 5 million heart failure patients in the US, about 1.6 million, so almost 40%, have a family caregiver in their home to help them with either activities of daily living or instrumental activities of daily living. Activities of daily living are things like bathing, toileting, dressing, and ambulating. Instrumental activities are more around the areas of paying bills, cooking, shopping, things like that. Support provided by family caregivers is critical to maintaining the health and quality of life of the over 23 million individuals worldwide affected by heart failure. And when they asked if they had a choice about taking on the responsibility of providing care for a loved one, half of caregivers self-reported they really didn't feel like they had a choice. The person got sick, somebody needed to help them. I guess that's me. So when we think about particularly caregivers of heart failure patients, there were a few ahas that came out of Hamilton's research in 2016, looking at African American families who were caregivers. That included a recognition of self-neglect. They were like, oh, I never thought about that. Calling others to provide support and share the work, experiencing the blues, sometimes just feeling like, gosh, I'm just exhausted with this kind of work. Communicating with the healthcare team, financial challenges, and patient non-adherence. All of these actually were aha moments that were experienced by the caregiver. About 96 LVAD patients in 2 US hospitals that were studied by Bruce in 2017, they demonstrated that there was a reduced risk of mortality when the caregiver understood the severity of illness and options. That reduced the risk of death for the patient by 76%. If the caregiver had an identified backup system, again, 73% reduction in the risk of mortality. If they had extended family to care for the patient, a reduction of over 50%, about 59%. At least one child who lived nearby that had an impact on mortality of about 72%. The ability to provide logistical support, again, reduced mortality by about 58%. But if the patient lives without a caregiver, if the patient lives alone, the risk of mortality tripled. It went up 3 times higher than those patients who lived with a caregiver, which I thought was a really impactful statement. That for many patients, living with a caregiver is really what helps them in that day-to-day process. This is baseline caregiver characteristics that were found in a study that I'm writing up right now. We're looking at baseline caregiver clinical characteristics in 3 groups. Those caregivers of patients on destination therapy, MCS, those who are awaiting heart transplant are on an LVAD while they're waiting, and those that are waiting for a heart transplant without having an LVAD at that particular time. What you'll notice is that from all of them have basically the same kind of medical history. On average, they have about 2 medical conditions of their own. And when we ask them, do you think your health will be affected by providing caregiving services to a family member, basically the range of scale was 1 to 10. The lower score meant that their health would get worse. And you can see that basically they all felt like basically it's not going to impact my health very much. So, and there was no significant difference between those groups. The other thing that was really important was we took a look at quality of life measures for these individuals on the EQ5D3L visual analog scale. Basically, we asked them to rate their quality of life going from 0 to 100, 100 being the best life they can imagine, and all of them scored in the upper 80s. And basically, they were all pretty much the same. When we asked them about depression, very few experienced depression. Their scores were very low. Scale goes from 1 to 20, and basically their score was in the extremely low range. But when we asked them about anxiety, there was a fair amount of anxiety, the highest being in people with destination therapy, mechanical circulatory support, and a little bit lower in the other two groups. So only anxiety, the level of anxiety varied between the groups. Otherwise, they were pretty much the same. Then we took a look at that baseline anxiety, and then we took a look at it over time. Basically, we looked at what we saw was over time, we see a reduction in anxiety in all three groups from baseline to 3 months, 6 months, and 12 months. So this is going out about 12 months. This data will be presented in November at the American Heart Association meeting. So importantly, when we see anxiety at the beginning in all three groups, it does go down, although not necessarily a large amount. You can see that there is a significant reduction from baseline to 12 months in the destination therapy group, as well as in the heart transplant people without a bridge to transplant LVAD. But in the LVAD group, waiting for a heart transplant, their anxiety level basically stays the same. And then we also noticed that by 12 months post-procedure, all three groups had similar low levels of anxiety. Again, the scores can go significantly higher than this, up to 100. So when we interviewed people about the impact of being a caregiver for a mechanical circulatory support patient, basically we noted, or Coleman noted in a 2019 study, 5 areas or 5 themes. The first one is the caregiver's own struggle with their emotions, with their sacrifice and lifestyle changes, the caregiver's coping for survival, encouraging independence, positivity using external supports, relationship burden and patient dependence. And then the 5th theme was diet-related tensions, like people not following the diet that they're prescribed and the caregiver feeling responsible for that. So we rely on caregivers to support advanced heart failure patients when they're in the community, whether they're on LVADs, whether they're waiting for a transplant, or whether they're just living with medication support at that particular point. And we commonly select caregivers by looking at those people who show up. We infrequently assess caregivers for their ability to provide care, especially over time. And caregivers commonly tell us about needs which could be addressed by the healthcare team that we need to take a look at. There are some successful interventions that have been identified, but more are needed to meet the needs of the many different kinds of caregivers and the many different needs that they have. And while the caregiver is not our patient, we do recognize that we must engage them and attend to their questions and challenges in order for us to optimize the outcomes for both the caregiver and the patient. But if you wait for it to be asked for something from caregivers, it'll be a long wait, because often they're feeling involved enough and busy enough and kind of entrenched in the whole thing that they're not likely to know what to ask for. So we talked about anxiety or stress, and one of the things I wanted to take a few minutes to talk about was really things that we can do to help to manage our own stress. So here we're going to talk about stress and maybe stresses in your life, and talk a little about strategies for reducing or managing it, and practice at least one stress reduction technique if we have time. So we know that stress can be defined as our mental, physical, emotional, and behavioral reactions to any perceived demands, whether they're or threats to the stability of our mental, physical, emotional, or behavioral health. So the purpose of stress basically is when situations seem threatening to us, our bodies react quickly to prepare us for that. So you think about this fight or flight experience. I love this cartoon because this guy is basically saying, you fight, I'm going to flee. And the idea is, if I don't have to run faster than the saber-toothed tiger, I only have to run faster than you. But the fight or flight response is a common one for us. It increases blood flow to our brain. It increases blood flow to our muscles so that we can run away. And physiologic responses can accumulate and result in long-term wear and tear on the body. Now, in the old days, when our stressors were things like the saber-toothed tiger and we ran away, we basically wore off all those stress hormones. But today, our stressors are often internal, and they're often things we can't run away from. It's all around me. It's every day. And so those kinds of stressors can be a lot harder to deal with, because we don't just get the chance to run away. What makes something stressful is if it is a strong demand, the situation might be imminent, if it involves a life transition, or if the timing is bad. So take a look at just a couple of these experiences. Obviously, it's going to be stressful when we're not when we're trying not to get hit by this car. It's going to be stressful when your calendar is so full that you can't figure out how you're going to have time in the day to go to the bathroom. It's going to be stressful when you're answering all the phone calls, doing all the paperwork, and trying to make sure that everything is staying afloat. So ambiguity, desirability, and controllability are also aspects of things that make things stressful. Not all stress is bad. Distress is a continuous experience of feeling overwhelmed or oppressed and behind in our responsibilities. And it is the all-encompassing sense of being imposed on by difficulties with no light at the end of the tunnel. So think about financial difficulties, conflicts in relationships, overcommitted, managing a chronic illness, or perhaps experiencing a trauma or an illness. So think about some of the things that cause you distress. And I just took some photos of some of the things that you all may be dealing with, continuous infusion medications or just medications in general, as you see here, dealing with bills and mail and all those other things that you kind of have to deal with, who's mowing the lawn and what about shoveling the snow, and all of these kinds of activities that you can see in the lower right-hand corner, all of which, although his legs are crossed and he looks like he's very zen, I would propose that having this many things to balance or juggle is going to make life stressful. So not all stress is bad. Eustress or good stress is the form of stress that's positive and beneficial. So think about that. It's stressful when you're walking across the platform to get your diploma. When you're getting married, it's stressful to make all the plans, but it's good stress because in the end, it's going to come out with a good thing. It's maybe stressful when you're receiving a promotion or when you're changing jobs, and yet they can all be positives. So think of positive stressors in your experience. When you get to the bus while the door is still open. So it was stressful running to the bus, but you got there while the door was still open. It may be stressful to go to a party. For some people, being among this many people all dressed up when you aren't, or you're just not comfortable with the group, can be a stressor as well. But it might be a good stressor as you meet new people and learn new solutions to problems. So a good example of a stressful situation for many people is taking a test. If you find that testing to be stressful, you might notice a lot of physical, behavioral, mental, or emotional responses. Like the physical response that I hear from people a lot is, I'm going to throw up or I'm going to have diarrhea. So think about that if you've ever heard about that from other people or from yourself. Behavioral response is just clamming up, just going into your shell and not coming out. A mental response might be just brain lock. Think about taking a test and not being able to do it because your stress level is so high that you can just barely think your way through the stressor. And then an emotional response would just be sitting at that desk and crying because all these other things are affecting me as well. So the reasons we stress out basically are, first of all, because we perceive the situation as dangerous, difficult, or painful, and we don't feel like we have the resources to cope. So, it might be something as simple as a sign, like there's ninjas and pirates and lasers and stuff, or it might be that I'm trying to catch a flight and I don't have any money in my pocket. So, common stress warning signals, and these slides will be made available to you all so that you can look these over in more detail. But there are all kinds of cognitive or emotional symptoms, behavioral symptoms, or physical ones. And it's important for you to recognize that these can happen to anybody. So it may be that you see those symptoms in a patient, moodiness or agitation or short-temperedness, or you might see it in yourself. Similarly, headaches or backaches or muscle tensions and stiffness, or maybe people are not eating much or they're eating too much. They're sleeping too little or they're sleeping too much. They're overdoing activities, like they're just going way at it. More cognitive symptoms like indecisiveness or not being able to remember what's supposed to happen tomorrow. There are health problems associated with chronic stress. Headaches, high blood pressure, heart disease, diabetes, and skin conditions. We also know that stress can be hard on the rest of our body as our immune system gets revved up, and we might experience things like arthritis, asthma. We might see depression or anxiety or insomnia. So how can you manage stress? There's a couple of suggestions that I found in the literature. The first one is working to keep a positive attitude. How do you do that? basically control your negative thoughts. So before they start, stop them. So that's a lot about self-talk, about living with gratitude, about using positive language, hanging out with positive people. If I'm around people all the time who are negative and talking about bad things, I just basically try to move away from them because it's not going to make me feel better and it's likely to make me feel worse. Another thing you can do is accept that there are situations that are not within your control. So think about the prayer that we hear at Alcoholics Anonymous about God granting me the serenity to accept the things that I cannot change, courage to change the things I can, and the wisdom to know which is which. So that becomes a really important statement to me, not because of necessarily because of AA, because it's bigger than that. Really, it has to do with there are things that I can't do anything about. So then I just need to let it go, and focus on the things that I actually have the power or the opportunity to actually make a change in. Third thing is set achievable goals. If you're going to do something, don't shoot for the moon. I know that there's that statement that says if you shoot for the moon, at least you'll land among the stars. But I like to take it more from the perspective of Lao Tzu, who said a journey of 1,000 miles begins with a single step. So take one step in the direction you're moving and see how that goes. Decide if that step was a good step, if it's taking you to the next step that you were thinking about, or if maybe you need to consider a different direction. Escaping the stressor for a little while is not a bad idea, easy enough to say. And often what we tell people is things like, go work out, take a walk, enjoy nature. And for some people, that's just harder to do than you can imagine. So for some things, it might be giving yourself a pep talk. And I did not include this because my name is Petty and Petty is in that little sign on the right. But it did seem to make sense to refuse to let small petty people distract you from your big purpose. So just giving yourself a pep talk. Or sometimes it's just a matter of taking yourself out of the situation and playing a game for a little while. Maybe doing a jigsaw puzzle, maybe playing solitaire, but something where you can think about something differently and not just focus on the stressor that's in front of you. A fifth recommendation is exercise. And exercise, we're not talking about going to the gym for an hour 3 times a week. Take a look at what you can see this on television. You can exercise simply by sitting in your chair and using this little bicycling kind of product, which will actually allow you to get some exercise without necessarily leaving the house. Or you can leave the house. Right now, it's gorgeous in the morning. I'm going out for a run about 7 or 8 in the morning when things are quiet and there aren't a lot of people and traffic around, partly because that's when the dog wants to go, and partly because I can get a run in as well. But just going out and enjoying the weather, especially as autumn is coming upon us. Look for social support. A lot of times people think that this is an experience that I have to hold all on my own and I have to stick just to me and I can't talk about it with other people. But there are others that are experiencing the same thing. And so talk with others about your feelings, especially perhaps in a group of other caregivers. Let them know what your experiences are, positive as well as negative, and see how you can achieve support from that. It's hard to talk to other people, but I think that it doesn't need to be a barrier, and many people are willing to listen. You need to smile and laugh. Is there anything I have to tell you every time I walk into a shopping center, every time I go into a grocery store, and I hear a little child laughing? I can't think of anything that's more contagious or more life-lifting than that. Or think about your favorite joke, like this French toast. What is soap? What soap is to the body, laughter is to the soul. Another opportunity is to be present, slow down, and notice what's around you. So whether, the old saying about smell the flowers, but listen to the wind, look at the leaves, or just look at the children that are around you or the people that are around you that bring you joy and make you happy. Think about taking care of yourself. What can you do like that? Well, first of all, think about trying to keep more of a work-life balance, including caregiving work and a life balance. So I'm not sure that many of us can do the 8, 8, and 8, 8 hours of recreation, 8 hours of rest, and 8 hours of labor. But recognizing that if I'm spending 12 hours on labor and 2 hours on recreation, perhaps I need to figure out how to make this circle work a little bit better for me. Eating a balanced meal and having a balance of good health. So it's not only about food, but it's also about all the parts of taking care of yourself that are important. And then, of course, everybody I talk to, I tell them you should drink more water. Now, what about learning to say no? This is easy for me to say because no does not seem to be in my vocabulary very well. But sometimes when somebody's asking you to do just one more thing, it'll only take a minute. You just need to say no. No thanks. Nope. No. But thank you. And thanks so much for thinking of me. Ask other people for help. The hardest thing. Now, it might be you ask parents and teachers for help. It might be that you ask a counselor for help, or a person of faith for help. Or it might just be that you ask a friend for help. But a lot of times, people are more than willing to help. And I can't tell you how many times I hear somebody say, let me know what I can do to help. And then if I had an idea of what somebody could do to help, I'm afraid to ask them. They've already told me it's okay, but yet I don't really ask. So the idea here is think about who is offered or who you might ask to just come sit in the house for an hour while I run out to get my hair cut. Because we can do that now after when COVID is a little bit less. Finally, meditate, relax, and focus on your breathing. The benefits of meditation, whether you do it in a strict fashion like mindfulness meditation, or whether you do it in a more generic sense, it can actually reduce pain and enhance the body's immune system. Meditation can help reduce feelings of depression, anxiety, anger, and confusion, can improve blood flow. It can provide a sense of life balance. It can actually help to reverse heart disease by taking down stress. It can help control thoughts or increase energy, and it can actually reduce stress. So mindfulness really is actually, mindfulness meditation is about staying in the present, not focusing on the things that are already past that you can't do anything about, nor focusing on the future when things might be coming at you or they might not, but you can get yourself pretty wound up in what might happen tomorrow, next week, next year. So really the idea of mindfulness is to focus on now and focus on what can I do right now. I see that Diane Behrman is one of the members of this conference today, and Diane has some spectacular techniques for helping people to practice relaxation or meditation. And actually, that's something that we may be able to try for just a minute in a couple of minutes. But finally, the American Association for Heart Failure Nurses has offered some ideas that they have put in an acronym called CARE-HF, which is recommendations for caregivers. First of all, take care of yourself. Eat a healthy diet, try to get some sleep. That will allow you to be a better caregiver. Be active. Go outside for a walk for 30 minutes every day or at least several times a week. Fresh air can make you feel better and sleep better and reduce stress. Reclaim some time for yourself. Read a book, go to church, get a haircut. All of these things can help to make you feel better. But more importantly, it's focusing that all of your energy doesn't need to be outwardly focused. Engage with others, looking for family, friends, or neighbors to help you. Besides easing your burden, they may appreciate, your loved one might actually appreciate the company. Have pride in what you're doing and be proud of the fact that what you are doing as a caregiver takes courage, and you're doing that. And then finally, find resources. So know where you can go to learn more about heart failure, about caregiving, or both, including Second Chance for Life Foundation, including your clinic and your coordinators and your doctors. All of us are more than willing to try and help you to identify some resources that you might not be able to find for yourself. Today, just do one little thing to take better care of yourself, and then repeat that tomorrow. It's a prescription. It's easy to follow. So I don't want to spend so much time on this talk that we don't have time to answer questions. So I think I'm going to wait on this stress reducing exercise until we get to questions, and then we'll come back to it. So does anybody have questions or things that they would like to talk about related to stress?